right, perfect. Well, welcome everybody. My name is Rachel and welcome to Virtual Shadowing Session 2, How Do I Get Into Medicine? If you would like to contact us more, you can follow us on our Instagram page at Virtual Shadowing. This session is going to be recorded and it will be on our website, virtualshadowing.com, as well as our YouTube channel, Pre-Health Virtual Shadowing. Today we'll be talking about how to get into medicine from the perspective of MD, DO, and PA school. In the upcoming weeks, we will be talking about the introduction to physician-patient interaction and how to assess, diagnose, and treat a patient. Following, we will have a specialty spotlight on emergency medicine, and then after, we will be talking about COVID-19. If you weren't here last week, here is our virtual shadowing working group. We have Reagan, Shayon, Taylor, Elena, me, Rachel, Aniruth, Miriam, our guest, Anthony, and we also have Dr. Ray Fowler, who is a professor of emergency medicine at UT Southwestern.
It's so nice to have you. Thank you for coming. Many of you, this may be your second time, and for those of you this is your first time, we welcome you. I'm a member of the admissions committee at UT Southwestern, and one of the things we have great interest in is if students have shadowing experience so that they know what they get into. We talked about if you know what you're getting into last week at our first session, and you can watch that session on YouTube by going to virtualshadowing.com and go to the About page, and you can click through to YouTube. We want to welcome you. Tonight is a very technical discussion. It's quite long, and we'll go until we get done. This is the stuff I kind of wish I had known 100 years ago when I was applying to medical school, and many of the folks who are our working group that you will meet shortly also have felt that there were a lot of the details that you will see here tonight that they wish that they had known when they were starting. So tonight we'll cover the brass tacks of how do you do this process. Rachel, take it away.
Thank you so much, Dr. Fowler. Okay, quickly we'll go over how this session will work. It is going to be a lengthy session. You guys have also asked for a longer session, so expect for this to be an hour to 2 hours. If you have a question, please put it in the chat as we go along. We will have 2 Q&A sections, one in the middle and one at the end. And then we will have someone announce the questions. Please keep your mics muted. The questions will be answered by our virtual shadowing working team. So with that being said, let's get started. First, let's talk about the difference between physician and physician assistant. Physician has 2 subcategories, allopathic doctor, MD, and osteopathic doctor, DO. They can do the same thing. They can do surgery, they can assess patients, they can treat patients and prescribe medication. The only difference is that DOs have osteopathic manipulative training, OMT, that they have to do. Another difference is that DOs have to take COMLEX to be certified as a DO, while MDs have to take STEP tests. But again, they do the same things. Physician assistants, on the other hand, practice medicine under the direction and supervision of a licensed physician. They can do most of the things that a physician can do, but they cannot perform surgeries on their own. They can provide assistance to surgeries. They also have the PANCE exam for their certification as opposed to COMLEX and STEP exams. Let's talk about the overall timeline for an MD or DO. In your undergrad,
Rachel, let me interrupt, and I'm going to, please forgive when I interrupt. Y'all take a good long look at this that are targeting pre-med about going to medical school, including MD or DO school. It's a long, long way, and just getting out of college to finally get into medical school, you're just getting started. You have 7 or more years to go in starting medical school, and you can't let down. You have to have great grades in medical school, including your STEP exams, so that you can get into the residency that you want. So think about this. This is a long way. I'm not talking you out of anything. I just want you to be aware of what you're getting into and the commitment that is required. Rachel.
Thank you, Dr. Fowler. So you have your undergrad, and in your undergrad, we will have prereqs that you need to do. And if you don't want to take a gap year, you should take your MCAT the end of your sophomore year and during your junior year. If afterwards, you will take your medical school application and apply to medical schools and have interviews your senior year. Once you get into medical school, you will have 4 years of medical school, where in your second year approximately, you will take step 1 as an MD or COMLEX 1 as a DO. In your third year, you will have step 2 or COMLEX 2, and at the end of your third year, you will apply to residencies and have interviews for residencies and match into those programs. In residency, you'll have to take step 3 or COMLEX 3, and if you choose to specialize, you will have a fellowship before you can officially practice medicine on your own. Now, again, what Dr. Fowler mentioned, this is a long timeline. Do you know what you're getting into? And we will go over details of almost every step in this presentation to hopefully inform you. Now, what if you want to be a PA? The PA timeline is slightly different. Like the MDDO route, you have the prereqs that you do in your undergrad, but instead of the MCAT, you take your GRE. After your GRE, you apply to PA school between your junior year and senior year if you don't want to take a gap year. And then once you join a PA school, you have a didactic year and clinical rotations. Afterwards, you will take the PANT exam, and then you can be a physician. You can also do a residency if you want, but that is completely optional. So those are the different timelines. Let's talk about some college coursework. For MDs and DOs, there are several prereqs for multiple medical schools, such as biology, chemistry, organic chemistry, physics, and mathematics, either calculus or statistics. It depends on the school. You also have additional prereqs such as English, biochemistry, and psych and soc. Does it matter when you take these prereqs? No. It is recommended you take it before you graduate, and especially before you enter medical school. Does it matter what major you choose? No. You can be a math major, you can be an accounting major, you can be an art major too, as long as you do these prereqs before you apply, or prereqs before you enter medical school. Do you need a perfect 4.0 to get in? No, you don't need a perfect 4.0. You need to have good grades, of course. If you don't start out with stellar grades, that's okay. As long as you show an upward trend, that actually proves to medical schools that you can be a great student. We recommend that you do your prereqs before your MCAT because a lot of these subjects will be on your MCAT, and we will go over how to study for your MCAT and what the breakdown is in future slides. The coursework for being a PA is slightly different. For being a PA, you need general chemistry, anatomy and physiology, organic chemistry, math, calculus or statistics, microbiology, genetics, and psychology, with additional psychology or sociology. Like the MD and DO route, it doesn't matter what major you choose, and it doesn't matter if you have a 4.0 or not. Just show that you have good grades or an upward trend of grades. That would be a great representative or a great factor to tell admissions committees that you are a great student. Let's talk about
Rachel, just to interrupt. On the admissions committee, we really look at organic chemistry. Organic chemistry seems to be a predictor because it's so darn hard of how well the student's going to do in medical school. So it's really important that for your OChem, you really buckle down. And so just think about that.
Okay, let's talk about the MCAT. What is it? The MCAT is Medical College Admission Test. It has 4 sections: Chem Phys, CARS, which is Critical Analysis and Reasoning Skills, Bio/Biochem, and Psych and Soc. It is typically an 8-hour exam, really 7.5. And traditionally, it is a 90 minutes for each section with 10-minute breaks and a 30-minute lunch period. For this COVID time, it is a slightly different time breakdown. It is now 76 minutes. Your exam will be graded and compared to all the students who take it at the same time and same day as you. So you will be graded on a bell curve. Each section will be graded on a bell curve. And all those bell curves will come to a total score, with the highest score being a 528 and a lowest score of being a 472. You can have your MCAT graded up to 3 times when you apply, and schools will see all your test scores, unlike the SAT and ACT. When I mean you can have it graded up to 3 times, you can take the MCAT more times. Say if you took it 4 times, you have to decide at the end of your MCAT to grade it or to void it. You can't wait until the score comes out to submit it to med schools. The only real reason to void it is if you physically couldn't answer half of the questions or a good majority of the questions in a section. If you feel not comfortable about your exam, that's not the best reason to void it. Most people don't feel comfortable about how they did after their MCAT, and actually it turns out they did fine. Each MCAT will cost about $320 to take. Now, when should you take the MCAT? There are 3 times you can take the MCAT: winter, spring, and summer, and that usually happens when you have a break from school. Take it when you feel ready. But please know that it takes 3 to 6 months to prepare for an MCAT. And if you are studying while you are a full-time student or you have a full-time job, please account more time into it. I took it twice. I took it studying during the school year, and I also took it when I was not in school. I did it in the summer. When I studied for it during the school year, I took about 6 months because I was a full-time student. I had classwork to deal with, quizzes, assignments. I was in extracurricular activities. There was just a lot more to balance. In the summer, I didn't really have that, so I took 2.5 to 3 months. Please just take that in mind when you sign up for an MCAT, if you have a full-time job or you are a student. Moving on, how do I study for an MCAT? What prep materials do I need? Well, you can get some books. Some traditional prep sites or prep books are Princeton versus Kaplan, which will cost about $2,000 to $3,000. Your school actually may have a deal with Princeton or Kaplan or some other prep material company that may give you a discount. AMC is the official prep material. AMC is the official company that makes the MCAT, and they have their own prep material. It's practice tests and practice questions, and it's about $300. There's also UWorld, which is $270 for 6 months. Now, how should I study? It depends on how you learn. You will hear so many different methods of how other people study to get a certain test score. Just figure out what couple things work best for you. From talking to many people in the virtual shadowing group and friends, the most common method is doing content review, practice questions, and full-length exams. Content review, you can do prep books such as Princeton and Kaplan. Princeton, I've heard, is a little bit more detailed, and the tests, their practice exams, are a little bit harder than the AMC material, so the MCAT seems easier for you. Kaplan is a little bit more straightforward and visual, and I think the Kaplan tests may be more representative, but see what works best for you. Flashcards such as Quizlet or Anki are good ways for repeating that information. Anki is just a fancy version of Quizlet where you can block out certain parts of definitions to make it fill in the blank questions, or you can also block out parts of images for studying anatomy. YouTube, diagrams, research papers, whatever. Just do some sort of content review. Practice questions. UWorld is a great place for practice questions. It is seen on the right. I think it's the most representative, besides the official AMC material, of what you will see on your MCAT. It even breaks down to how many people answer a certain answer and why answers are right or wrong. It even gives a little bit more detail of why explanations are right or wrong in their explanation compared to AMC. You also need to take full-length exams. The prep books have those full-length exams, and so does AMC material. They give you 3 full-length exams, as well as question banks to make your own exams too. If you need special accommodations, you can apply for those accommodations on amc.org. Now, let's talk about numbers. What is a good MCAT score? What is a good GPA? Well, it depends on your goals. There's usually some screening for both, but again, it depends on what schools you want to apply to. What you should aim for is probably a 510 and above for the MCAT. So if you remember our little bell curve from the previous slide, the 510 is the upper part of that bell curve. For your GPA, you should try to aim for a 3.7 and above for your overall GPA. Your science GPA shouldn't be too far different from that. On the right is going to be all the average applicants' MCAT section scores and GPAs of the applicants from last year. You can see they're kind of in that range. Again, what schools accept for MCAT and GPA is just different for each school. Please do your research, and we will give you resources to do that research. Also, for grades, they look for an upward trend, and if your MCAT and GPA isn't the best, they may look at your SAT scores to determine if you're a good student. Let's talk about PA schools. The main test for PA schools is the GRE, which is $205. What's a good GRE score? Well, 300 and above is good, but 310 and above is great and competitive. The GRE has official prep material by the company that makes it, ETS, and that's going to be about $40 to $80. We also have our traditional prep companies such as Kaplan and Princeton also making GRE prep material that's going to be $450. Other tests for PA schools is the PCAT or PACAT. It's the PA version of the MCAT, and it's going to be 3 hours with 180 multiple choice questions. The multiple choice questions are going to be broken down below. If you notice, a lot of these are actually the prereqs for PA schools. So for prereqs for PA schools and MD/DO, we recommend that you take all these prereqs before you do your exams. It is anticipated that schools will either accept GRE or PCAT for the next few cycles. You can also submit MCAT scores, but that's not really recommended. Applying to med schools. How many schools should I apply to? Well, it's up to your discretion. On average, applicants apply to 15 medical schools, but I've seen applicants go up to 30 medical schools. It's really up to you and what you're comfortable with, and also your time and the cost. We will talk about more about the cost of applying to medical schools in a couple of slides. For MD schools, you should look at Medical School Admission Requirements, MSAR. This is an online database of all the MD schools in US and Canada that talks about the statistics of getting into medical school, such as what average GPA they take, MCAT, if they have secondaries, what's the average applicant doing, what's their mission, stuff like that. If you want to go to a DO school, you can go to Choose DO Student Guide. This is basically like MSAR, but it doesn't give all the statistics of the accepted individuals. MSAR is about $40, while I think Choose DO is free. When you are making your medical school list, you need to consider several things. You need to consider your stats, so your GPA and your MCAT. It is recommended that you don't really apply to schools more than 4 points above and below your MCAT score. Your geographical region, do you have close ties to that state? Are you an in-state applicant or an out-of-state applicant? Your geographical region actually matters to schools. A lot of states like in-state applicants. And then, do you fit with that medical school's mission? Do you connect with it? You are applying for a place that you will be staying for the next 4 years if you're applying to medical school. Now, the application timeline can be used for both MD, DOs, and PAs. You will do your primary application around your junior year, and then summer of your junior year if you're not taking a gap year. Then you also have secondary applications. You will have Casper, which is a computer-based assessment for sampling personal characteristics. You will have interviews and acceptance, and we will go over each step individually. Let's talk about the differences between application processes. First, we have MCAS, which is for all the MD schools in US and Canada except for most Texas schools. The fee is going to be $170 for applying to one school. Any additional school will cost $40. You'll have a personal statement, and you can put up to 15 activities in your application. 3 of those 15 activities will be denoted as meaningful activities where you can talk more about stuff. TMD-SAS is the application portal for most Texas schools, 12 out of the 15 Texas schools. It is a flat fee of $185 with 3 essays, a personal statement, personal characteristic essay, and also unique experience essay. The last 2 are optional, but you should do them. Again, you can put your activities in these several sections, and you have a meaningful activity section. ECOMAS is the application portal for DO schools. It is going to be $196 for the first program and $46 for each additional program. It has a personal statement and places where you can categorize your activities. It's an application for 39 out of the 40 DO schools. TCOM is in the TMD-SAS. CASPA is the application service for physician assistants. It will cost $179 for the first program and $55 for each additional program. It has a personal statement and now an additional essay on how coronavirus has impacted your journey. For more information about each application portal, please visit the respective websites.
Rachel, let me interrupt here for a second. I want to direct your attention to the TMD-SAS. For example, look under the resume and look at all those items, please, because you're going to see them again when you're filling out your application. Notice academic recognition. Search in your past to see where you may have been acknowledged. It's important to fill that out if you have it. Leadership activities such as sororities, fraternities, and so forth, your church or other activities you may have. Research activities if you have them. Healthcare activities, of course, we'll come back to all these. Community service activities. These are all very important. And don't be embarrassed to talk about what you do for leisure. If it's weightlifting or swimming or running or doing yoga, that's fine. It sort of adds to your overall humanity picture when you talk about yourself. So I just want to encourage you, and Rachel, go ahead, but I want to encourage you to make sure that you address each of those sections. Rachel.
Yes, thank you. Now, as you can see, this can be an expensive process. MCAS has, or AMC has a fee assistance program that you can apply to if eligible. It has several benefits, such as MCAT benefits. You will have a reduced registration fee for your MCAT from $320 to $130, and MCAT official prep products benefits. You will get MSAR for free, which is a $36 value, and you also get an MCAS benefit where it'll waive all MCAS fees for one application submission with up to 20 medical school additional designations, which is a $970 value. You can be awarded the fee assistant program up to 5 times in your lifetime and the MCAT official prep product benefits once in your lifetime. For more information, please visit amc.org. Now, let's talk about the qualities of medical students. These are qualities listed on AMC, but these are qualities that any medical professional should have going into the field. Ask yourself, do you have service orientation? Do you have a want and need to help people locally, nationally, or globally? Do you have social skills? Are you aware of other people's feelings and behavioral cues? Can you adjust to those feelings and behavioral cues? Do you have cultural competence? Can you interact with people from a diverse background? Do you have teamwork? Yes, you can lead a team, but if you have shadowed anyone in the field or seen medical providers work in the field, you know that the doctor or the PA is not the only person helping you out. There's multiple people in the medical team working with the doctor or the PA to help a patient out. Can you work effectively with other people? Teamwork is very, very important. Let's look at more qualities. Can you effectively communicate with people? And communication also involves listening. Can you listen to other people? Are you ethically responsible to yourself and to others? Are you reliable, independent? Are you resilient and adaptable? I'm sure all of the medical professionals today did not expect for them to deal with a pandemic, and they need to be resilient and adaptable to what's going on, not having enough PPE, having panic go on around them. Can you learn from what has happened and your setbacks? Can you learn from them and improve from that? You're always going to have problems and conflicts in life. Can you use that and those lessons to help treat patients? All these qualities can be found on AMC, and these are good things to kind of think about and reflect about yourself. Now, let's have a mini Q&A.
Rachel, let me start. Can you go back to the previous two slides? Go to the first one, and then we'll come back to the second one. Can you back up? Yeah, and go back to that one right there. It's very important, folks, that you look at these things that are in the highlights here. The service orientation. These are important activities to have, and it speaks to a person who has been a broad member of his or her community. The social skills also are very important. We're looking for folks that know how to interact, how to talk, that they're reasonably warm and friendly. The cultural competence, perhaps the present events that you've seen in the news now the last week, we've never been more sensitive to the fact that we have to acknowledge and build on our similarities, but our differences as well, and we must be sensitive to them. And finally, about the teamwork, you must approach your application process of your desire to be a member of a healthcare team. It's one thing to say about leading the team, but you may not necessarily be the team leader per se. So being a real advocate for helping build teamwork in patient care is exceptionally important. Next slide, Rachel. We're going, okay, yes. You're going to be called, among other things, for an interview process, and you've got to work on your speaking skills. It's going to be important to look them straight in the eye. And if, for example, these are virtual interviews, that I think it's going to be odd if you don't look at the little green dot. I have a green dot here on the screen so that you're looking at them directly. We'll have to get past all this virtual stuff this year to see how it plays as far as interviews. But oral communication is very important. The ethical responsibility to yourself is the fact that you take care of yourself, those around you, your loved ones, and in the things with which you're involved, that you show great sensitivity to the needs of others. Your reliability is very important. There was a study done here at this university last year indicating that the single most likely thing that a physician later might get in trouble with a medical board was the failure as a medical student to complete assignments on time. Reliability and dependability talk about who you are, and I cannot emphasize that enough. Obviously, resilience and adaptability important. There's a question came over the chat a few minutes ago about, just how hard do we really need to be able to get going on the first day of medical school? And I'm saying you got to be ready to rock. You got to be ready to study, because what that resilience is about is your ability to show work. There are two things you have to be a doc. You have to have a reasonable aptitude. You do have to have enough smarts to be able to understand this very difficult field you're going to, and you have to have the work ethic. This medical school will not come to you easy. It requires a lot of work and a lot of organization, and that is as demonstrated with your capacity over time for your self-improvement. Rachel?
Okay, and so now I will open up for Q&A. If Taylor could read out the questions, and the rest of the virtual shadowing team be ready to answer.
All right, so I have some highlighted questions that we have taken down. So the first question that we put down is, when should I have my prereq courses completed? Does it need to be done before I apply?
It should be done before you apply. It should absolutely be done before you apply. You, like, for example, statistics, you could use it on your MCAT. You don't necessarily need it on your MCAT, but you do need it for multiple schools, so you can take it after you take your MCAT. You can take it your senior year if you want to. Definitely recommend at least those core science prereqs to take before your MCAT, such as biochemistry for that bio section. It's a huge part of it. Chemistry, organic chemistry is a good one. Psychology is pretty good to take before your MCAT as well. Yes, you should, long answer short, you should have them before you graduate.
And then the second question is, does geographical location, region, matter for private schools, private medical schools? Does it matter where you live if you're applying to a certain school, maybe out of state that's a private school? Does it affect you?
I think it depends on the school. Dr.
Yes.
Fowler, do you know?
Yeah, different schools have different ratios of how many students they will take, for example, from out of state. At Southwestern, we take about 10% of our 230-member incoming class from out of state. That's just a rule that we have locked in. So the schools will have some variability, I expect, if that answers the question, Rachel.
I think it does. And I think it also depends on the school. I think Baylor considers every school, every applicant to be out of state. So I don't think geographically that matters for them. But I'm not sure of that.
All right. And then the third question I have is, do some medical schools recalculate GPA since the grade scales vary across colleges?
Yeah, so for Texas schools, at least, I'm not sure too much about out of state, but Texas schools, if you're applying through TMDSAS, even if you go to a university that has a plus or minus system, you're going to be, your grades are going to be converted automatically to just, either 4.0, 3.0, 2.0. So there's no plus or minus in that application. So that'll kind of clear that up.
I believe it's the same for MCAS and ACOMAS. Anthony, is that the same for CASPA?
CASPA does have the plus and minus system.
Okay.
And then I'm going to read two more questions. The other one is, why are Texas med schools applicants at an advantage? I guess that's someone's opinion. They just thought that that's what they thought about it. So why would we be at an advantage as a Texas medical school or something?
Yeah, Texas actually has a law where the 90% of the incoming med students in Texas at, I believe it's public and private med schools in Texas, 90% of those have to be Texas residents. So we're automatically at an advantage as far as that goes. Only 10% of the remaining students that enter their first year of medical school come from out of state. I don't know if Dr. Fowler wanted to expand on that as well, but.
Yeah, that's great.
That is true. Okay. And then the last question I'm going to cover is, how many shadowing hours are recommended? Is it important to diversify shadowing hours, or can most of them come from shadowing? Maybe they mean from the same location, shadowing the same person, or at the same time. Maybe that's what they mean.
Let me take that one. Shadowing is very important. I've been on the committee now 9 years and was interviewing before that. And I think I've learned more and more about what we're looking at when we're looking at shadowing. We really want to know, do you have any idea what you're getting into? I personally think it would be important to try to shadow as many as the equivalent of a shift a month for a year, which would be, say, an 8-hour shift, and a year is 12 months. If it's 8 hours a month, that would be 100 hours plus or minus. So, and if that was spread out over 4 years of a college program, that would be perfectly reasonable. I would try to target something about like that. We know that kids are having trouble. A kid is a compliment, by the way. We know the kids are having trouble finding shadowing hours. That's why we're doing this website. If y'all keep coming back, we've got 296 participants on the screen right now. If y'all keep coming back, we'll keep doing this, and you could pick up, shucks, you know, if it's an hour a week, that's 52 hours a year, you know, of just coming and hanging out with us here at this website. So shadowing is very important. I don't want to go too long here, and as are equally these other aspects that we talked about, such as community service and so forth. Rachel?
Yes, and we'll go actually in detail about the application in the second half of our presentation. So that was a good segue.
And I was hoping to just go back to that question regarding out-of-state, out-of-state private schools discriminating between in-state versus out-of-state. There are some out-of-state private schools I've heard that discriminate based on region. So maybe not the state itself, but the region that the college is in. So maybe like Northeast or the Midwest. But there's probably a list on Google. If you can Google it, they probably have a list of colleges that have done that historically.
Yeah. And as far as I've heard from my personal experience that if you're applying as a Texas resident to an out-of-state medical school, or I guess maybe PA school as well, I'm not sure if they have a similar like 90% rule, but they are likely to ask you during the interview, you know, why would you come to this state when you're already at an advantage in Texas? You know, you may have to explain yourself. I don't know if they commonly do that, but sometimes they may kind of throw a curveball at you. So maybe you'll have to have a good answer for that as well. Do you really like that state, or, you know, what is the reason?
It's good to check MSAR. That's like the database that AAMC has. It usually has descriptions from each medical school of what they prefer, if they want more people from their state or region, or if they don't have any preference. So MSAR is a good reference for checking if private or public schools have a preference.
MSAR is great. It's only $36. Maybe you can share with a friend or two, but I think it's worth getting MSAR. All right. Are y'all ready to move on? All right, let's do it. And then again, we will have another Q&A at the end, but feel free to continue putting your questions in the chat. We are so glad you're here and asking questions. All right, let's talk about the application itself. Primaries. For MD and DO, like Dr. Fowler said, you need to have a lot of activities being done, and you need to be a well-rounded student. You should have healthcare activities. I think that's pretty important, you know, to show admissions committees you have an idea of what you potentially could be getting into. Research looks good, not necessary to be published either, but it looks good. Leadership and non-healthcare related activities. Non-healthcare related activities I think are just as important to include as healthcare activities. Such as your hobbies and passions. What if you were playing volleyball for 10 years? Put that down. That shows that you have dedication, you can have time management, you are taking care of yourself by exercising, you have teamwork because you're on a volleyball team, you have to work with people, and you have a way to de-stress and have a clear mind to do coursework. I think would be incredible to put on your application. Another thing to put on, what if you've been playing an instrument for years, like playing the tuba for years or playing the piano? That would show a medical school admissions committee, hey, again, you have time management skills, you are persistent and determined, and also maybe you're dexterous. You know, a lot of instruments need two hands to work. For your experiences, you will need to note some of them as meaningful experiences. About 3, I believe, and you need to reflect on how is this helping you grow as a person. If you're not currently applying, you can still prep for this part of the application in freshman or sophomore year by starting to get involved in a lot of different things. Be well-rounded. Medical schools or PA schools don't want you to just be a linear applicant. They want you to be someone who is well-versed and can explore different things, someone that's interesting. And if you are not currently applying, but you're thinking about it, you can keep track of the total hours you do per activity per week. That will make applications so much easier. And you can also make a little excerpt about, why was this important? Why did you do this activity and not another activity? Was this special to you? What did you learn from it? That's something you can do preparing for your application. Primaries for PA are slightly different. What is the same is you can put down research, volunteering, shadowing, non-healthcare employment, leadership, extracurricular activities, and teaching experiences. What is different is patient care experience and healthcare experience. Patient care experience, you should aim for at least 1,000 hours, but the hour requirements are different per school. According to CASPA, patient care experience is experiences in which you are directly responsible for patient care. And these are some examples of positions you can do for patient care. Again, these definitions are going to be different for each school. Some schools may not take scribe as being patient care experience. Please look into that. Another thing that is different is healthcare experience. Healthcare experience does not equal patient care. According to CASPA, healthcare experience is both paid and unpaid work in health or health-related fields where you are not directly responsible for a patient's care, but may still have patient interaction. Again, look into what your school's definition of healthcare experience and patient care is. Continuing on to primaries, they are the essays. All applications have at least the personal statement. The personal statement can be 5,000 characters to 5,300 characters. And when I mean by character, I mean every space, letter, punctuation, whatever is considered a character. All applications want to know why you want to be in medicine. Some applications might vary that a little bit and ask, why do you want to be a PA or a DO or a physician or whatever? They're all asking why you want to be in medicine. Don't tell your reason for being in medicine. You can say a reason to be in medicine is, I have a passion for learning. Great. You should have a passion for learning, absolutely, for medicine or any other fields. You're always going to be learning in life. But strictly saying, I have a passion for learning could be the same thing Billy Bob Joe over here is saying for 1,000 other applicants. They could be saying the same exact thing. Don't just say it, describe it, back it up with experiences. Take the reader emotionally there with you. For example, instead of saying, I have a passion for learning, I could be saying, I loved researching and looking up the material outside of class, talking to my peers, discussing with professors outside in our office hours about the material we've learned in class. Biochemistry, I've learned mechanisms and pathways that really helped me understand the COVID pandemic and how COVID attacks the body. That would be a way better explanation of having a passion for learning rather than just simply stating, I have a passion for learning. Don't worry if your experiences or your reason to be in medicine is not unique. For example, your reason to be in medicine could be that you want to help people. That's fantastic that you want to help people. We need people in medicine that will help. But again, that statement saying, I want to help people is the same thing that Billy Bob Joe over here could be saying and 1,000 other applicants could be saying. Explain
Rachel, let me interrupt there too. Folks, for the 295 of you that are online with us right now, pay attention to that third bullet, the part about the fact that you want to help people. I know that's as corny as it sounds. People say, why do you want to go to medical school? Because I want to help people. Let me tell you something, folks. That is the reason to go. That is the reason that lasts. That is the reason that prevents burnout. And burnout is rampant in the medical profession today, as it is in emergency medical services and other areas wherever you look today. But you have to express and be clear about what do you mean about helping people? Why? How? Why are you so committed to being involved with others? And when the question ultimately will come to you on an interview, well, what are you going to do if you don't get in? You said you want to help people. Well, if you don't get into medical school, then what are you going to do to help people? Do you already have that figured out? Rachel?
Yes, and we will be also talking about that later in the slide. Thank you for giving everyone a sneak peek. But yes, wanting to help people is a great reason to be in medicine, but explain your unique journey on how you got there and what experiences affected you. What sparked that interest? Was it your experience in the healthcare field, or like when you were in the hospital, or your family member was in the hospital, or a friend was in the hospital? Did you see some teamwork happening with healthcare professionals that really inspired you to be like them? Did you see something in your shadowing or volunteering or employment? Talk about that. Take them on that journey. But don't be too fluffy. Get to the point. Don't write I. Don't have bad grammar, but also take them on that journey. Be sure that you reflect on how this journey helped you want to be in medicine, or helped you gain the knowledge or skills to be a better healthcare professional in the future. Disclose your medical mission. What is your goal as a future healthcare professional, and how can medical school or physician assistant school help you achieve that goal? A book that I loved when I was writing my personal statement was the Pre-Med Playbook, Guide to Medical School Personal Statement by Ryan Gray. Dr. Ryan Gray also has a YouTube channel if you want help there additionally, and this book is about $20 on Amazon. This book really helps for you to see what is fluffy and what is really gonna inspire people to want to meet you and get to know you. If you're not in this point of your medical school journey or your PA journey, you can still think about it and reflect, what have you done currently that has put you on this path? Start early on this essay, months in advance even. Don't be afraid to rewrite. I rewrote my personal statement from scratch 3 times, and I had about 10 drafts for my personal statement before I was happy with the message that I wanted to portray to missions committees. Start early, write and rewrite. Let's talk about more essays. So the TMD SAS has 2 optional essays, but you should pretty much do them. You have your personal characteristic essay, which is 2,500 characters, and your unique experience essay, 2,500 characters as well. For the personal characteristic essay, please describe your personal characteristic or experiences that would add to the educational experience of others. For inspiration, you can look at that list that we just talked about that is on AMC, the characteristics of a medical student. Or what you can also do is ask your friends or family to describe you in 3 words. Medical admission committees don't know who you are. They know what you put down on a piece of paper. Your friends and family know who you are. If they can describe you in a couple characteristics, put those characteristics in your essays for them to get to know you. Are you a leader? Are you dedicated? Put that in. For your unique experience essay, briefly describe any unique experience or life experience that are relevant to your application, which you have not previously presented. You can talk about any red flags on your application, such as an arrest or failing classes. Please don't get arrested. Please, please, please don't get arrested for anything. But if you have, you can talk about it, own up to it, and then move on, saying that, you know, this will not affect you and you can still be a good medical provider. What you can also talk about, if you haven't gotten arrested or failed any classes, you can talk about cool things you've seen in your activities that help you be a medical professional. Or you can talk about something unrelated to medicine that has helped you grow as a person. Secondaries and Casper now have a new essay about 2,000 characters that is your chance to explain how COVID has affected your medical journey. Another part of primaries is the letter of recommendation. For all applications, you need a minimum of 3 letters of recommendation and a maximum of 5. Who should you ask? You can ask professors, physicians, employers, mentors, community service leaders, anyone that knows you. Not necessarily someone you just did well in their class. they might not know you and they could actually give you a bad letter of recommendation. It's not that uncommon that someone will get a bad letter of recommendation from someone they did well in their class. Like, hey, they got an A in my class, but I also had 300 students and I didn't get to know this person. He's probably a good student, I'm not sure, but here's my letter of recommendation. That's not an uncommon letter of recommendation. So really think about who you want to ask and make sure they know you. How should you ask? Well, make a connection. Show interest in their interest. Meet up with them in person. You can also send them a detailed email about your experience with them and why it's so important for them to write you a letter of recommendation. Give your letter writer about 4 to 6 weeks times to write the letter with gentle reminders. There's no deadline for the letters of recommendation, but do it as soon as possible. What are committee letters? Committee letters is a letter authored by a pre-health committee or pre-health advisor and offers evaluation and advocacy on your behalf by highlighting your background and accomplishments, contextualizing challenges, and outlining your overall preparation pursuing this career. This is combined with your 3 to 5 letters of recommendation into one packet, and this is great for sending off your letters of recommendation. You don't need to write and ask each letter writer to do this certain method for each application process. The committee letter does it for you. Let's
Rachel,
talk about.
let me comment back. Go back to that previous slide, please. What Rachel said about asking a professor, say, that was maybe the 300 student biology course that you were in, that you really don't know the professor at all, and the professor doesn't know you, and that you made a good grade. What we're looking for in these letters are people who can speak to who you are, your work ethic, your smarts, and perhaps some things that you've been able to do together. For example, a research project, an essay that you worked on at the professor's request. But you might get a letter that's really not helpful. And we would wonder, why did you ask someone to write a letter who really doesn't know you? And that letter indeed may be exactly what Rachel said. Well, Mr. So-and-so said he was in my class. Well, there are 300 students in the class, and he made an A in that class, so he must be a good student, and I imagine that he'll do pretty well in medical school. Yours truly. You can tell that that's not a letter written by somebody who knows the student at all. Rachel?
Yes, so again, make sure that whoever writes your letter of recommendation knows you and get to know them as well. Secondaries. So you're not done with just primaries. You have secondaries, and they are additional essays and questionnaires sent by each school. They can be sent by the schools selectively or to every applicant that has applied. There's usually a fee when you submit an application. So if you apply to 15 schools, you're going to have 15 possibly secondaries to do, and each secondary costs a bit of money. Secondaries are school specific, so focus on the interests of the particular school while staying true to yourself. Take secondaries as seriously as your primaries. Secondaries should be submitted within 2 to 4 weeks after being received. Admissions committees will not look at your application or consider you for an interview until your secondaries have been submitted. This is a way for you to show your interest in school and really have the medical schools or PA schools get to know you a little bit more. Another secondary is the Casper exam. What is Casper? Casper is a computer-based assessment for sampling personal characteristics. It's a personality test for addressing situations. This is needed by several MD, DO, and PA schools. You can view on Casper's website to see which schools need it. Casper is a 90-minute exam with 12 sections. Each of the 12 sections will have 3 questions, and you will have a total of 5 minutes to answer each question. You can take it at home with your laptop as long as the webcam is on and the mic is on. And Casper is an additional fee. It's about $12 to send it per school. So if you're sending it to a lot of schools, that will add up. How do you prep for it? Well, it's a personality test, so you can't really study in that aspect, but you can prep how you answer the questions and how you can put your personality into your answers. You can take typing tests online for free to improve your words per minute. I think the average word per minute for typing is about 30 to 40. If you want to increase that to put more of your personality in, you can. You can take sample practice tests on Casper's website, which is for free. It's not really recommended you buy practice tests or do some other course for it. Casper's official information is good enough. You can do multiple mini interview questions to practice how you would address situations. For example, on Casper's website, there is the sample situation of, okay, your male coworker wants to take a paternity leave to support his family, but your company has opened up a new project that could potentially give him a promotion in the future to really support his family in the future. He wants to take the paternity leave, but it doesn't seem like the company is really open to paternity leaves. What do you recommend to your coworker? So that's kind of how Casper is going to ask questions in either a video form, or they'll ask you to reflect on your own situation. A way you can address that, and this is up to you, is the PPRDJ method: problem, perspective, responsibility, decision, and justification. What is the problem? Your coworker is not sure if he should take a paternity leave or not. On one hand, he could support his family now, or on the other hand, he could get the promotion and support his family later on. What is your responsibility as a coworker? What do you recommend, and why? So that's a way you can answer Casper. When should I take Casper? As soon as possible. Casper is technically a secondary, but some schools don't even give out interview invites until they receive your Casper grade. You don't receive your Casper grade, and Casper takes about 2 to 4 weeks to score. Again, some schools don't give out interviews until they receive this grade. I have heard that UTMB will not consider your primary application to be complete until they've received your Casper score. So look into each school that you're applying to see what their policy is on Casper. Let's talk about some do's and don'ts of applying. Do start early. You have a lot to reflect on. Do your research on the schools. Do dress professionally. You are applying for a multi-million-dollar job. Dress professionally for that. Do the optional essays. Do practice interviewing, and we will talk about interviewing in a couple of slides. Do take care of yourself, physically and mentally. Are you ready to take on the career and the path of medical school or PA school? Do use good writing skills. Maybe use Grammarly. I don't know, have a friend look at it. Read it out loud. Don't get arrested for DUIs or underage drinking. Don't get arrested. Don't drink and drive. Don't put your resume in essay form. That's not interesting to read. And they have basically your resume there. They want to get to know you. Don't be negative. If you have something negative in your essays, that's fine. Don't focus on that. Don't use I too much in your application. That's not good writing skills. And don't lie.
Rachel, let me follow up with a couple of these things. And that was terrific, the way you put that. Folks, when she says you're interviewing for a multi-million-dollar job, you know, a typical physician's salary across America is somewhere around $200,000. It could be less in certain specialties. It could be a lot more in other ones. But let's use that number just for a moment, $200,000 a year, from which, of course, taxes are taken and benefits and all those things. But it's a $200,000 job nonetheless. And let's say you have a 30-year career. You should. I'm at 42 years now. And so 200,000 a year times 30 is $6 million, folks. Folks, when you're applying for this job, you're applying for a $6 million job. You got to look the part. Please don't put a picture on your application that looks like this. Folks, you're applying for a $6 million job. Do you expect them to hire you? Now, that may be okay if we look at that picture I mentioned, if we look at the whole you and we realize what a great student you've been and what a happy heart you've got and just you were just expressing yourself on that particular photo. But I urge professionality. You're getting into a profession. You're getting into a profession where you can't be wrong. The decisions you'll make in healthcare once you buzz through med school and buzz through residency, you're on your own. You are dealing with human life, and it is serious. So act the part. This thing about don't get arrested, don't drink and drive, folks, I'm not kidding about this. If you get a DUI, you will probably not get into a professional school, or it'll very much get in your way. So if you've got a bad habit, stop it. If you've got something that you need to get hold of in your life, face it. Get help now, and study that and move on. Part of life is about growing. And it is expected that we will all grow in our lifetimes. We're all going to make mistakes and so forth. But for goodness sakes, don't torpedo yourself after all the hard work you are doing to get in professional school by doing something stupid. Do not be in a car driving with alcohol in your breath. Don't do it. And then finally, and Rachel, I'm sorry about it, just one last point. When we read your essay, we're reading it, among other things, to see what kind of a writer you are. Now, being a great writer, being a Hemingway, doesn't flunk you or not flunk you for a medical school app. But folks, for goodness sakes, tell your story of your life, which is what your essay is, about why you want to help people. And do it in a beautiful narrative way. Get folks to critique it and edit it. And so, and don't begin every sentence with the first person singular. It's not good writing. Rachel.
Thank you for highlighting those points. Please take these to consideration when you are applying. Let's talk about interviews. When can I expect an interview? Probably interviews will go out July to February. Trust the process and stay patient. What are the different types of interviews? You can have two different types. You can have a traditional interview or multiple mini interview. Traditional interviews will have interviews with medical staff, faculty members that you can have a casual conversation with, or a stress interview where they grill you with questions. And/or they can have an open closed file to talk about. Ethical questions can also be asked. Multiple mini interviews. They can test your ability to make ethical judgments and solve problems. You can be presented a scenario where you'll be asked a question by an interviewer or engage in a role-play scenario with an actor. To prep for interviews, you can read Multiple Mini Interviews by Samir Desai, as shown in the upper right. How to prep for interviews. Practice, practice, and practice. And you can research. Research about the school, research about current events. Maybe you can see if your school gives you resources to practice your interviewing. You can read the Pre-Med Playbook, Guide to Medical School Interview by Dr. Ryan Gray, as shown above. Prepare for the questions you can ask the interviewer at the end of the interview. Those are ways you can practice interviewing. But again, practice, practice, practice. What to do if you didn't get in? That is an option, or it is a possibility. Should you reapply? Should you apply somewhere else? If you want to reapply, you can call schools after the admission cycle is over to meet with an admissions committee to review your application. See why you didn't get in. Maybe there's something you can improve on your application, like you need more hours of healthcare activity, or you need to rewrite your essays. See if there's something you can do about yourself. Do some soul searching. Pick up a new hobby. You can apply to a post-bac program and connect to graduate schools. This can prepare you for the rigor of medical schools and help you build connections. So what if you don't get in after that? Are you going to keep on reapplying? It's not feasible to keep on reapplying and reapplying and reapplying until you get in. What if it's 54 years from now and you're still not into medical school or PA school? Consider a backup plan. There are numerous ways to help people in other career paths if your reason to be in medicine is to help people. These areas include social work, supply chain management, healthcare management, research, and other careers. There are more ways to help people. Remember, you want to be a part of a team, and that team is made of multiple different members. You can be a different member. It doesn't have to be an MD, DO, or PA. You can also take a gap year. Gap years are not bad, and they're actually becoming mainstream. What can you do during your gap year? You can research, shadow, get a job, prepare for the future in medicine, travel, and take a break. You're allowed to take breaks. Be sure to do something worthwhile and productive, as questions about your gap year can come up in interviews and be a good discussion point.
Rachel, let me take that point. Just stay on. Yes. When I look at an application, there's absolutely, as Rachel said, nothing wrong with a gap year, and indeed would encourage you to do so. Gap year to me is sort of like fellowship after your residency. It gives you a chance to do a little bit of something more. For example, you might start a master's program, but don't start a master's program unless there's something you want to study, a particular field, whatever that field is. Don't just do it to be taking a master's. Do it because you have a burning interest in that area. Generally speaking, I think it's nice to do something academically during your gap year so that I would know that you're staying in school, you're still working, still show you can make an A after a year or two of a gap period, so that you can demonstrate that still academically you're very focused and you're ready to get started. You just wanted to do something else for a year before you then began the professional part of your career, namely medical school, then residency, possible fellowship, and then the rest of your life in your practice. Rachel?
And I would like to add on to that both my sisters have gone through medical school, and actually a good part of their medical school classes are not students that came straight out of undergrad. A lot of them have taken gap years, several gap years. Some have even had careers, full-on careers before applying to medical school. One of my sisters had a former accountant go through medical school. Gap years are not bad. So you got in. What's next? You're done, right? You can just be a doctor or a PA. No, you still have more to do. In your first and second year, you'll have preclinical years, and about the end of your second year, you'll take step 1 as an MD or complex 1 as a DO. Step 1 is now a pass-fail exam, but it's a science-based exam. It tests, do you know your stuff? DOs can take step tests and complex tests to apply for more residency programs. Then you have rotations, and then you have step 2 and complex 2. This is more clinical based. Can you apply your knowledge to cases? And step 2 is now the measurement of what kind of residency program you can get into. A certain score can get you into pediatrics, but I think a higher score is needed for something like dermatology. Then you apply for residency. And after you get into residency, you'll do potentially a fellowship, and within your residency, you'll take step 3 or complex 3. Let's talk about residency. What is residency? Residency occurs after the completion of medical school, and it is for you to specialize in a field. This is optional in a physician assistant track. Is it necessary? No. You can do it. I don't see why not. You shouldn't. Residency can vary depending on the specialty. You can apply for residency at the end of your 3rd year, and you will match to residency programs. What I mean by match is when you interview at multiple residency programs, you yourself will rank all your residency programs, and all residency programs will rank all the applicants. So if a residency program ranks you in the top 5 and you rank them the top 5, you're gonna match. If you put the residency program in your top 5 and they put you at the bottom 20, most likely you're not gonna match. An algorithm matches you to a residency based on both rankings. Let's talk about fellowship. What is fellowship? Fellowship is a period of medical training after the completion of residency where you can subspecialize. You can subspecialize in fields such as internal medicine, neurology, pediatrics, OB-GYN, orthopedic, emergency medicine, general surgery. A popular thing that I've seen on your email responses is a lot of you want to be cardiothoracic surgeons. If you want to do that, you have to take a residency in general surgery first, and then do a fellowship in cardiothoracic surgery. If you want to do, say, sports medicine or pain management, you need to do a residency in emergency medicine and then do a fellowship there. Fellowships, again, are specializations. So after this, you can be a doctor. There's nothing wrong with this process, right? No, there are some risk about this journey. There's burnout. Burnout is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. It can occur when you feel overwhelmed, emotionally drained, and unable to meet constant demands. And in this PowerPoint and throughout this PowerPoint, we've attached articles for you guys to read. We will send out this PowerPoint for you guys that you can read more about burnout and other topics. For burnout, there are 5 stages. First stage, the honeymoon phase. You can conquer the world. You have high productivity levels, unbridled optimism, and a commitment at the job at hand. Stage 2, onset of stress. You start lacking in productivity. You have anxiety, forgetfulness, and an inability to focus. Stage 3, chronic stress. You get a physical illness. You get social withdrawal, anger, aggression, apathy. Stage 4, burnout. You have self-doubt, social isolation, chronic headaches, chronic stomach problems, and escapist activities from society, friends, and family. You don't want to interact with anyone anymore. Stage 5, habitual burnout. Chronic mental or chronic physical fatigue, chronic sadness, and depression.
Rachel, let me interject here that, folks, the reason at the time we're talking to you about how to apply is that we're also talking to you on the back side of this thing. There are medical students that are depressed and burned out already. And certainly we know that in medicine, an enormous number of physicians, of nurses in nursing, mid-level practitioners and so forth, in fact, feel burned out. A friend of mine defines burnout as being, it's the reaction of a normal person to a toxic environment. I mean, I work in Parkland ER on Friday nights like I did last weekend, and we see all these folks who are taking terrible care of themselves, whether it's alcoholism, drug abuse, or drinking and driving and getting injured and so forth. And you do this year after year. I mean, I've been doing it for over 2 generations, and you could find yourself slipping into a thought pattern where you cringe at your work. And that's what burnout is. It's where you don't feel the passion. I love going to work. It's the best thing I do, seeing patients in Parkland ER. And it's important for you as a professional to start mentally safe, to maintain mental safety along the way, and to always work in a very positive way to take care of yourself and your loved ones around you. Rachel?
Yes, and like Dr. Fowler said, a lot of people can have burnout. Why is burnout so important in this path? Well, the risk of burnout is higher in medical professionals than the general population. Burnout has been linked to higher rates of depression, substance abuse, and suicide. Suicide in the general population is 12.3 per 100,000. Suicide in medical professionals is 28 to 40 per 100,000. That's twice and a little bit more than twice the rate of the general population for suicide. Let that sink in. How do I combat burnout? Our own lovely Reagan Rosenberger has written an article about burnout, which you can read, and we've attached this onto the PowerPoint. So if you want to click through that later, you can. It's on GEM's website as well, GEMS.com. And 3 ways you can combat burnout is 1, time management. Create a schedule that helps you put your task into focus. creating more efficient use of your time. You can schedule breaks. Breaks are okay. Positive outlook. Identify where energy is being used and if they are providing a negative or positive effect. Try incorporating more positive effect activities in your life. Say if running relaxes you, or cooking, or watching Netflix. Do that more in your life. That will make you so much happier. The third one that we'll talk about is locus of control. Learn where you have control over your life and let go of things you have no control over. You don't have control over what people think about you. You don't have control over the weather or, I don't know, how sick someone else gets. You don't have control over that. Relieve your stress over that, and that will help you so much. Let's recap the timeline, shall we? For the doctor timeline, MD-DO, you have your prereqs that we recommend you take in your undergrad or before you apply to medical school. Or, sorry, not before you apply, before you get into medical school, so before you start your first day of medical school. If you don't want to take a gap year, take your MCAT your junior year or the summer before your junior year, and then apply to medical school the summer after your junior year. Afterwards, when you get into medical school, you have your preclinical years and your rotation years. In your second year, you will most likely take step 1, or if you're an MD, or complex 1 if you're DO. These test times vary per school. For your third year, you will take step 2 or complex 2 and apply for residencies, where then you interview and then match into residency programs. Once you get into a residency program, there's step 3 or complex 3. And then after, if you want, you can take a fellowship. Only after that entire timeline can you be a doctor and you can practice medicine on your own. Let's look at...
Rachel, let me chat on that for a second. I have to express, and Rachel, what a great job you're doing on this presentation. I have to express that you have to do well in medical school. You've got to buckle down and study. The predictors that a medical student may not do well later is not showing up on time for events like rounds and so forth, and failure to complete assignments on time. You have to do both. But notice, for example, in emergency medicine, which is my field, we have a residency training program here at Southwestern and Parkland. And we will get about 1,700 applications for 22 spots. If you apply to our residency, you have a 1.5% chance of getting in. That is so small, folks. And so it means that you might end up having to move across the country for residency if you don't match at your first choice. We look at your STEP exams. You must do well on those. We look at your GPA in med school. You must do well there. Apply yourself well. We look at the evaluations that are done by your attendings and the residents for whom you'll be working during your M3 and M4 years. And so you have to really buckle down and do well and pay attention to all aspects of what it takes to be a good med student who will be a good candidate for a residency program. Finally, about fellowship. Fellowship is sort of like taking a master's program. You want to do focused study in one area, like toxicology or sports medicine or cardiothoracic surgery or nephrology or neurology and so forth. And so that is where you want to subspecialize and to make an additional long-term commitment to a particular area of study. Rachel, please.
Thank you for describing that more and how important the exams are. I think that is very important to know. For the PAs, you also have your prereqs, and then you have your GRE or potentially the PCAT in your junior year, and then you apply for PA school the summer after your junior year if you don't want to take a gap year. You'll have PA school, which is 2 to 3 years, and the first half will be a didactic year, and the second half will be clinical rotations. After, you'll take the PANCE exam. You can also do a residency, but that is optional. After your PANS exam, you can be a practicing physician assistant. From the virtual shadowing team to you, we wish you good luck on applying. We don't want to scare you for this application process and your medical journey, but we want you to be aware of what you're getting into potentially. This week's assessment is due on Friday at 11:59 p.m. We are still trying to send out all the assessments from last week. If you did the new link for the last week assessments and it did not say your name and your email, just shoot us an email and maybe screenshot proof that you did it. If not, just shoot us an email. Again, you must do an assessment to get credit for this week. This is the link, but hopefully we'll have that link in the chat and also the pin. If you need more help, you can check the official online guidelines for each application portal. There's also Facebook help groups that you can join, like TMDSAS Hub. We have put links in the PowerPoint for extra material in the speaker's notes to help you out. Again, you can contact on Instagram and our Gmail for any more questions, and I will now open it up for a Q&A.
It's me now. Answer to pull up some questions. Okay, some of the other questions that we got were, how do you think step 1 becoming pass-fail will affect everything?
So I've had this conversation with my sister actually, and it's probably going to make your third year worse than it actually is right now, because now your step 2 is going to weigh so much more, and you also have residency to apply for. If you're doing the DO route, you could also be doing your step 2 and your COMLEX 2 at the same time. Some schools actually do them back to back, step exams or COMLEX exams back to back. It just depends on the school. But overall, it's going to make the third year worse and more stressful.
Oof. Okay. All right. What are the pros and cons of taking a gap year?
It depends on how you work and your mental state too. If you've been stressed out in your undergrad, I think it's a great idea to take a gap year. You don't want to be burned out before you even start the harder part of the journey. You can relax, but at the same time, if you have a gap year, that there is a concern that you may not be used to doing the course load or the amount of course load at one time. If you don't think you will be able to bounce back from it, then maybe you don't want to take a gap year.
And something that I've actually heard too personally is that gap years can actually be favorable in many circumstances. You're kind of you're maturing in that gap year, whether it's 1 year or 2 years. As long as you're being productive in those years, that can benefit your application a lot more than if you were to apply earlier. Nothing against applying earlier, of course, but if you're still looking for things to do and you don't have the time to do it in 3 years, gap year is a good option. I think at least, I read somewhere that at least half of the current medical students in the US have taken at least one gap year. So it's a really common thing now to do. There's nothing bad about it, really, unless you're just sitting and not doing anything for the year. So don't do that.
You can travel.
I think I wouldn't. Yeah, I think I would. Yeah, well, certainly traveling. That's very important. It's a great thing. Traveling, as Rachel was putting it, is an opportunity for self-enrichment and for expanding your worldview and your contact with other cultures, other societies. I think the way to look at a gap year is not only as a time to rest, but it's also a time to do a period of personal self-enrichment and self-study and further study in certain areas. I would encourage you to stay in school somehow and continue to make A's while you're in school during a gap year.
And that covers one of the questions. One of the questions was about should I stay in classes during? So you kind of answered that if you can. It's recommended that take some courses. And then another question that we had was where does scribing fit in on the application? Is it a healthcare activity, employment, or shadowing?
It is one of those areas that I consider, and I think we consider here, scribing the closest thing to shadowing, because you are side by side with a physician or the other practitioner at another level, such as a PA or an NP, in which you are actually evaluating patients one at a time. and you're seeing the patient care process, the history, the physical, ordering tests, the formation of a differential diagnosis, the formation of a treatment plan, and the care of the overall patient, the milieu, if you will, of the healthcare environment.
Cool. And then I guess I'll answer one or two more. How much weight does a committee letter have in a med school application? Is it okay to not have committee letter or to only rely on 3 to 5 individual letters?
Well, it depends on what your school requires. Some schools are going to generate your health or your HPAC, healthcare programs advisory letter, and so you may not have a choice in that matter. So you'll have to start with what your school requires, and we very carefully read those HPAC letters, because the HPAC letter basically is putting an application together for you by summarizing you as a person, and they are very articulate, they're very well written, and they address the areas of your grades, your MCAT, things you did that got you out of high school, advanced practice credit that you received, advanced placement, I should have said credit, and so on. So it depends on what your school requires.
And then one of the other questions I had is, are DOs limited to which residencies they can get into?
Not in my experience. We certainly place DOs in our residency here. We consider the MD and DO to be identical in terms of the training and the capabilities. Indeed, MDs do not have training in osteopathic type manipulation and physical therapy. So there is an additional skill set there. So we consider, I consider them equivalent.
And then I guess I'll continue to read some of the questions that we have. What if I don't pursue academics in my gap year? Does that look bad?
I think it just depends on what you do. If you disappear for a year and you don't discuss, because we look at your whole timeline. We will break out your timeline and look at it. And if you just disappear for a year, we'll kind of be wondering what you did with your brain for a year. Did you just put it on hold and so forth? This is why I personally think that a person during a gap year, and a gap year is fine, takes the time not only to chill a bit, but also to do some sort of self-enrichment, including some portion of that being an academic pursuit as well, Taylor.
And then, let me see. Do medical schools have a specific number of hours / years that an applicant should participate in research? So,
no, not really. Research helps you if you've done it. If you did a little bit of a dabbling in a paper that you did for a class, and then you write that up as if that were a research activity, it really isn't. That was a class assignment, and we will see through that. If, on the other hand, you joined somebody's lab and you became their research assistant, and from which you got a scholarly publication, that defines an area of what research is. It doesn't hurt you if you don't. It does help you if you did.
And then it's something that I saw as an interesting question. Since COVID is affecting our ability to get shadowing hours, hospital volunteering, patient care hours, will our requirements be adjusted when it comes to time for us to apply?
We simply don't know, because COVID is just as new for us as it is for you. We will be doing predominantly virtual interviews this year unless this epidemic lightens up. And as of today at the hospitals here in Dallas, as I mentioned, there's no evidence that it's lightening up right now. So I suspect we're all going to be in masks for a long time to come. And so that you will be doing your interviews virtually doesn't mean to me that you have any less chance of getting in. As I mentioned a while ago about the part about looking at the little green light of where the camera is and trying to maintain good eye contact across the screen, I think that's good practice. On the other hand, I think we're all going to be doing these virtual interviews for the first time this year, and that it's going to be a bit of a different situation. And so if we find that a student is staring downward at the screen, looking at the person interviewing them, I think that we will understand that.
Alrighty. Another one of the questions is, What do medical students tend to lack during their first year of medical school, aside from medical knowledge?
Well, most have very little medical knowledge. Out of college, they have a lot of general scientific knowledge from OChem, PChem, physics, and so forth, embryology, and so on, all the things that you could study as an undergrad. So we understand you don't have a lot of medical knowledge when you first get there. The thing that we're looking for is coming to class. Now, most of our lectures here in the first year, at least, are virtual lectures. But wherever attendance is required, you have to be dutiful to do that. You must get your assignments in on time. I hope that's clear. I'm just saying, you don't want to set yourself up, for a negative review in that regard. So what you bring to medical school is that you've got some smarts, that's called aptitude, and you've got the work ethic to make it happen. That's what you demonstrate in college. MCATs, in a way, we're looking at what kind of smarts you have and your test-taking ability, whereas your GPA is really both smarts, but your aptitude and your willingness to work hard, and that's what it takes to get through this.
And then another one was, does each med school have their own essay questions, or is it the same application for everyone, I guess, in Texas versus like the out-of-state programs?
I can't directly speak to the out-of-state except for where I've seen applications to out-of-state programs or out-of-state universities. Certainly in Texas, if you do the TEMSDAS application, you will have a standardized written essay process.
Alrighty, flying through these. Okay, so would a high school senior rotation class count as shadowing experience? So I guess it's something that they experienced that was somewhat like shadowing in high school. Would you put that down?
It depends on what you did. For example, if you were able to get in and shadow a physician and actually do that in high school, yeah, you should put it down. I think it will count. I have had a student before who was a high school student who's now at SMU, who shadowed me all the way. This kid's halfway through SMU and has been working with me for 5 years. So I would certainly put it down. The shadowing hours that really count will be during your undergrad period. Or if you did a gap year, use that as an opportunity to shadow also. So we will predominantly focus on those areas that I mentioned.
A quick thing to note, on all the applications, they ask for what you did going into college or after high school. So if you did a continuing shadowing from high school and throughout your undergrad, yes, you can put that down. I think you can mention it started at high school, but when you put it down for applications, you're supposed to start it right after you graduate high school and count the hours after. If you did only shadowing in your high school time frame, you're not supposed to put that down anymore. They want your undergrad.
You might address that. You might address that in your essay, for example, or one of your essays.
Which you can really do. I think I did it in one of my essays.
All right, and then some of the other questions we have, does clinical research look better or worse than lab research?
Both count. Paid research, where what you're doing is doing DNA testing, and you're not really generating a research, but you're doing really technical work, is really not research. Research where you're part of a team that's trying to answer a specific question, especially if you got a paper out of it, even if you're 10th author on that paper, that is research. You were part of the scholarly writing process, and so you would want to list that.
All right, and then something along the same lines is, are dry lab research activities viewed the same as a wet lab?
Yeah, I think pretty much. Again, it depends on what you're working on. I have a research coordinator now who's pre-med, and we're working on a whole lot of dry issues that are actually not wet lab type experiments. They both count, especially if you can get a scholarly publication out of it.
All right, let me see. I think there's another good one. It says, how are non-traditional applicants evaluated differently since they can't get committee letters from a university? So I
That's
guess
a great,
everyone isn't able to find rec letters.
that's a great question. We start with the fact we look at the whole person. We have plenty of applicants to this medical school here who've had other lines of work. We have lawyers, engineers, people that have had other professions, and then they grew away from it and decided that medicine was the right career for them. I think it's important that they track on their essays their maturation process about how they came from point here to point there. And the fact that someone's had a prior career does not in any way negatively affect their application process or the application.
And then I just found a really good one. So is there a chance you won't get into residency after completing medical school?
Sure. And if you make mediocre grades in medical school, if you don't interview well for the residency, you may find yourself without a job concluding medical school. It happens sometimes. Indeed, we have the white coat ceremonies where we will stand in a circle and hand the acceptance letters for our residency here to the folks who have matched here, especially from this medical school. So this, and you will, many of you who are listening to this, we still have over 200 people online here, will very likely not know what you want to do for a career path. You know it's medicine, but whether it's surgery or internal medicine or neurology or OB-GYN or emergency medicine, you don't know yet. You want to make up your mind when you get into medical school. You will have to do that fairly promptly, but you may be on the wards your third year before it really settles in. That's perfectly normal and perfectly understandable, but you must know that these residency applications are going to be very competitive. And so you must keep your scores up, do well on your steps, and with every rotation, make sure that you arrive early. If the rounds are at 7, then your arrival time, ladies and gentlemen, is 6:45. At 6:46, you are late. That's what I do on shift at the emergency department. And so that you show that you're a ready and willing and helpful candidate for the residency program. Taylor?
Oh, I also wanted to add something quickly about residency and match in terms of my sister's experience or like what she's had classmates do. Some didn't match, and their school, UTMB, gave an opportunity to kind of match within their own school as a way to help them out, or you can try to reapply next cycle to match into a residency program. So it's not the end of the road if you can't get in the first time.
And I think there's a good 1 or 2 more questions that I want to touch on. One of them is, does non-science research count? It's like for such as like sociology or psychology research, does it count as just as much for?
Positively. For example, let's say you want to do a burnout study in medical professionals. Reagan Rosenberg and I did a study. We sent out an international survey, and we got 1,500 replies back of paramedics. And we asked them if they were burned out, and for them to score it. And then if they were burned out, does that mean they don't want to do that anymore? And then in our paper, we offered mitigation strategies for burnout. You saw some of that quoted in Rachel's wonderful talk tonight. And so, no, it doesn't have to be lab-based. It doesn't have to be DNA samples. It can be stuff that's sociological. And it doesn't have to have a medical topic to it at all. But it still needs to be a scholarly pub where it has data. It has a methods section. It generates data. You analyze the data and you come to a conclusion. And if it's really a scientific paper, you compare that conclusion to the null hypothesis, namely, I think that it's going to show this, and then you present the results of your study. In fact, it showed this. Did it support the null hypothesis or did it not, for example?
Gotcha. And then one of the last 2 questions I'm going to cover is, as a PA applicant, is it okay to shadow non-PAs? Does this count?
Oh yeah, I was actually just responding to that in the chat. Some programs do require that you have PA shadowing hours while others do not, but I would still aim to find a PA to shadow, even though it's pretty hard.
Shouldn't you get like a PA rec letter too?
Yeah, some programs require PA rec letters while others do not. It's very specific to each program. So whichever program you're interested in applying, I would just look at their website and see what the requirements are.
Okay, Taylor, you got another one or last one?
I think one of the last ones. I guess I'm trying to find a really good one here. There's tons of different ones. Maybe.
I guess.
Yeah, if you have a good question, you can go ahead and share.
Okay, yeah, sure. I guess one of the questions that I think a lot of people could have is, how would the admissions committee look at an applicant who retakes certain prerequisites for PA school post-grad? This can also apply to MD. So does it look worse that you're retaking it after you graduate? I don't know if anyone.
Cheyenne, I really didn't follow the question. Do you mind restating it? Do you mind?
Yeah, sure. So I guess, so once you graduate, let's say you're pre-PA, you're graduated, and you wish to retake one of your prerequisite courses in order to do better in it, and assuming, I guess, you're taking a gap year or something, does it look bad that you're retaking it?
It doesn't look bad. Let us say you made a C in OChem, for example, and that you just, or God forbid, a D or a W, where you withdrew. With a W, obviously you would have to retake it if it was a prereq like OChem. I think taking it again is a good thing, provided you make a good score. If you took a C one time and made a C a second time, obviously we would see both of those. If you made a C the first time, let's say OChem, and you made an A the second time, we're going to see both scores. And we're going to give you some credit for the fact that you went back and you retook it and you demonstrated that you could do well in that course. You might even mention that in one of your essays that you decided to go back and retake it because you knew how important that was. Taylor, got another one, or is that it?
I think that's it. I think for the most part, that's most of the questions we covered, or we could cover.
Oh, there's actually one last one that's kind of important too. So as far as someone asked how many shadowing hours are recommended, I don't know if we touched on that already, and if it's important to diversify shadowing hours. Did we already talk about that?
I would seriously target trying to do the equivalent of, say, an 8-hour shadowing shift, the equivalent of once a month for a year. That would be 8 times 12 is about 100 hours. Now, if you do that over the 4 years of college, which would be one shadowing shift 4 times a year, that's not a lot of work. And the question, so I would try to do that. And the question also is, Cheyenne, I believe you said, and what about a diversity of different specialties? Absolutely. We look at all of them. If you did, 8 with family medicine, and you did 8 with OB-GYN, and you did 8 with EMS write-outs in the field, you did 8 in the emergency department, so on, 8 with a surgeon, that's fine. That a diverse number of hours, it shows that you're keeping your mind open about what it is that you want to do with the rest of your life.
There was one more also that Ethan just asked in the chat. It says, if you're on an accelerated path through college and therefore will be applying when you are 19 or 20 years old, can being younger cause admissions committees to be skeptical of you or question your maturity?
Well, we occasionally will see someone that just clearly indicates from the way they write their essays, from the letters, their reference letters, that they just can demonstrate that they're not really buckled down yet, and that maybe they need a year. They're only 19 or 20 and applying to med school, and that they just can't indicate that they're really well-rounded yet enough. They haven't done any community service, for example. We will occasionally feel, especially we've got another straight A candidate who's got, gobs of community service, shadowing time, is a first author on a scholarly pub. Clearly they just don't rank at the same level. And, we on the admission committee, believe it or not, are human. And what we're trying to do is find people who can pass this school, who want to become doctors, especially for the state of Texas, who don't demonstrate personal characteristics that they might drop out, and thus we have one less doctor for the state of Texas. So the long-winded answer is that we're looking for someone who has indicated that they have the maturity and the preparation to move on into med school, and the very long path, the 7+ year path it's going to be able to finally have a job.
I guess there's one more very common question as well. Sorry. So this one is, how do medical schools view transfer students from community college to a bigger university? Of course, considering the rigor is different,
There's no problem with that. We want to see that you did well at the community college. Those credits, of course, obviously transfer to the to the university that you then attend. I would just say that we look at the entire transcript. We go all the way back to the beginning, including any advanced placement hours that you may have from high school, which seems to be a very popular thing today. Shayan, I think that answered the question.
Oh yeah, no, that was good. Thank you. And is non-traditional, the person asked, is non-traditional bad, I guess, as far as applications? Are they looked at unfavorably compared to?
Absolutely not. No, absolutely not. And for example, if you want to major in Japanese and take a gap year in Japan studying the culture, and you don't even declare a minor, or you may declare a minor, and the minor happens to be in biology, that's fine. You just got to do well on your prereqs. I keep emphasizing that OChem is very important, but just because it's a predictor, we think, for the ability to show the smarts that you need to get through medical school. But no, a broad, well-rounded person is someone who is a desirable candidate for medical. Okay, Shayan, you done? Taylor, you done?
I think so.
Miriam, I see your face there. Anything from you?
Oh, wait. Sorry, Miriam can go first.
No,
there's a couple more questions coming in.
Yeah,
okay.
answer the questions.
One of the questions is, how do medical schools view those with mental illness?
Mental illness is normal. Most common cause of suicide in the youth. Start that statement over. Most common cause of death in youth in America today is suicide. My Lord, mental illness is everywhere. It's been estimated that 1 in 10 Americans are alcoholics, and that with so many people being locked away at home, that it's only getting worse. Everybody's been depressed. Everybody's dealt with issues where they felt less than motivated and so forth. What matters is how you deal with that. It is normal to make a mistake. If you get through life without making a mistake, I want to meet you and buy you lunch. Because what is normal is that all of us struggle with things. And what we want to hear about is your struggle, what you learned from the struggle, how your maturation process helped you through it, and what is it like on the other side. We've seen people with eating disorders, people worry about being gay, things that, it seems politically incorrect to talk about today. We don't judge about such things. What we look for is how a person deals with the challenges of life and moves on from those challenges. There's a question right there, Rachel. Would including this program in my application be viewed as padding? I don't think so. And, you can list this thing, and we'll do a little bit more work on the website that Dr. Fowler and team, Dr. Fowler from UT Southwestern and team in the middle of the COVID epidemic have put opportunities to be up close and personal with a physician online. List virtualshadowing.com. I know that when I see students applying this year who put this down, and I'm sure there will be quite a number of you, that I'm not going to see it as padding, and I'll speak to the committee accordingly, that I said we did this because the students, we put the word out through TAMO, UNT, UTD, and Texas Tech, and over 600 kids said we need shadowing time. We said, well, fine, we'll put our faces online for a while and let you have the opportunity to interface and interact. We're going to be talking about the physical exam process, right, Shayan, next week? I believe that's correct. Right. And about how you do that. And then the week after that, we're going to, I believe that's the one we're going to talk about the COVID experience and how it's affected medicine and so forth and so forth. And we will listen to you about programs that you would like to hear. We've already gotten a list. I think Miriam and Rachel, this is correct, that we've entered onto the spreadsheets, the types of specialties that the writers said that they would like to hear. So we'll bring someone in from OB, emergency medicine next week and the week and so forth, to try to do day in the life type things of these doctors. I'm seeing questions, a couple of them about MD, PhD programs. The MD, PhD is the research scientist, and so I'm on the committee that interviews for the MD, PhDs also. And to be able to successfully apply for the MD, PhD program, you have to be a research scientist really already. You're involved with someone in their lab or in their social surveys or whatever that is specifically pursuing specific topics related to some scientific, area of science, especially that would include toward scholarly activity. Scholarly activity means, of course, that you've done the science, you've written up the surveys so that you can try to contribute to the overall scientific process. I see a question about oncology being asked. If enough people ask for an oncologist, we will certainly ask one to come.
Is there a way to include a publication we are part of, but that it is still undergoing review and hasn't been published? Can we still put that on our application?
Absolutely. Just put it down the way you put it, is that we did this research, we have written this thing, and it is being compiled and written for submission for publication. That counts a little. There's no hard facts on this. The fact that you did it is important. And yeah, if you manage to be first author in a New England Journal publication, as opposed to, a non peer-reviewed type pub, yeah, we look at those because we knew what the effort was involved to get that publication in a major journal, for example. What else?
There were a couple questions about MD, MPH programs. Like, I guess, how would that work? When do you apply for that sort of program?
You typically apply at the beginning. And we not uncommonly have folks who've maybe done a little med school already and then they transfer. Though most commonly what we see is folks who are, say, a typical applicant, I'll just tell you, is someone who is completing a period of research, say, at the National Institutes of Health, and that now they want to actually get their MD degree and move on to the MD, PhD program. Well, folks, it's 4 minutes to the hour, according to my watch.
He froze.
Other questions? Thanks for staying with us for 2 hours.
Get online. If you want us to keep doing this, would you just type it in? Well, yes. Who doesn't do TV for a living? I thought you were great. I'll hire you anytime. And so, but if you want us to keep doing this, we'll do it. The link for the post-assessment is a bit slow and not loading, it says. But if you want us to keep doing this, put yes in the chat and send it. And we will, I just have yes go through. Well, that makes us feel warm and fuzzy.
Wow.
That's very kind of you. It's a labor of love for us to do this. Please take the exam. It's not hard. It's 10 questions, 10 or 11. And we're trying to work on a certificate. I'm going to be playing hardball about the virtual shadowing hours, at least on my committee. And we will be setting up which specialties will be coming over the next few weeks. Tuesday nights for now at 7 seem to be the best working time for all of us on this end, at least through the summer. And then we can look at a schedule as we get more closer to the fall. So from the team, Mariam, you're at top. I see your picture. Anything from you?
No, I mean, I think we had a really good session today, and we answered a lot of questions. I hope it cleared up some things for pre-medical students. I wish I had all this information when I started. So, yeah.
Mariam has been accepted to medical school, Texas Tech, right?
Yes, yeah, Texas Tech.
And do you feel like this presentation tonight that you saw, that if you had seen it earlier, might have been helpful to you?
Yes, 100%. If I knew this, like, I had to kind of figure all this out during, like, on the way, like, as I was going. So, this would have helped a lot. That's why we created this to help you guys, so you guys are aware of what to expect in the future.
Thank you. Rachel, I'll come to you last. Taylor, any comments from your end on you're going to be able to put up with Miriam in that area when she gets there?
Yeah, I'll have to teach her the ropes, What's an undergrad? I'm just kidding. No, she'll love it. Lubbock is cool.
Any closing comments from you tonight?
Oh, from me?
Okay, Shayon, you're next.
Okay, I'll go. No, I think it went really well. I hope that the information was helpful for everyone. Excited for next week's topic as well. We're going to be talking, like Dr. Fowler said, about the physician and patient interactions and physical assessments and things like that. So we're looking forward to that.
We're going to be talking a lot about practical knowledge about how to approach the patient. Many, if not most of you, are going to be amateurs, rank amateurs, and that's fine. We don't expect you to be experts when you walk into an exam room for the first time. But we're going to talk in significant part about how to tell things about people, especially things that may indicate that they're sick. For example, patients with a tachycardia, a fast heartbeat. We'll come to that. Good. Ani, are you hiding down there somewhere?
Nope, I'm right here.
There you are. Last closing comments?
Oh, it was a wonderful presentation. Nothing else to say. Fantastic.
Thank you, Ani. Alana, you're being awfully quiet. Where are you?
Yeah, this was great. I think that, because I'm an undergrad as well, so I'm going through this right now. So I think that this is a great research tool, a reference tool. So I think, we're posting this on YouTube. So if you guys ever forget about something when a due date is, I think this is a great way to go back and see what's due at what time. So
great.
Yeah.
Who am I missing? Reagan, you're out there somewhere. Closing comments?
Yes, just wanted to let everybody know that the assessment is going to be open tonight until Friday at 11:59. So be sure to go ahead and get that done before then. And we will try to have your certificates for session 1 out to you guys soon. And then hopefully for session 2, we'll have those over the weekend for you guys.
Thank you. And Anthony, thank you for joining us from the PA's perspective. It is my considered opinion that the phrase mid-level practitioner is not an acceptable phrase. It's probably not politically correct anymore. But the very important role that physician assistants and nursing practitioners play in the care that is given at this era is exceptionally important. Any closing comments from you, Anthony?
No, thanks for having me. I learned a lot, and I'm not even pre-med, so.
Well, great. And so, Rachel, you want to close it out?
Thank you for listening. We really appreciate all the interest. We love seeing your responses in the contact us for what you want to see. If you have not yet put in the specialty that you want to see, go to our website and fill out the contact us and tell us what specialty or maybe what topic you want to talk about. We'll try to get to them as soon as possible, but we're also ranking them in terms of popularity, how fast we'll try to get to them. Again, thank you for listening, and I hope this was helpful.
And from all the team, we want to thank you all for tuning in, and we wish you all a great evening. Good night.